Being a cancer survivor, defining cancer survivorship, it really is broad and means different things to different people. Here at the American Cancer Society, our definition of a cancer survivor is anybody who's been diagnosed with cancer through their treatment, beyond treatment, and through the rest of their life. Nutrition for all of us is so important, but particularly for somebody going through cancer treatment and beyond, it's critically important. We know that the treatments that might be utilized in cancer have an impact. They might be impacting how much or what somebody's able to eat, which can affect their nutritional status. There might be side effects that somebody has that really prevents them from being able to eat as well as would be desirable, certainly. We also know that cancer treatments can, cancer, radiation, chemotherapy, can have an impact on how the body metabolizes different nutrients. And so for so many years, the American Cancer Society has published guidelines on nutrition and physical activity for cancer prevention. Actually, just for the first time in 2012, we published formal guidelines for cancer survivors. And just in a nutshell, those guidelines are watching your weight, being active, and eating a healthy diet, eating lots of plant foods, watching the amount of red and processed meat, eating lean, healthy proteins. We talk about eating more fruits and vegetables. We think a lot of the nutrients in fruits and vegetables help protect cell membranes from damage. From a whole grain perspective, we know that the fiber and other nutrients in there can have an impact on reducing cancer risk. But what's really at play here, we think, is the synergy of all of these nutrients, all of these vitamins, minerals, fiber, antioxidants, phytochemicals really working together to really protect our cells from either developing cancer in the first place or continuing to grow and expand as cancer cells. We're absolutely seeing that weight matters in terms of cancer recurrence, and so we definitely, we want to encourage all cancer survivors, all of us in general, but cancer survivors in particularly, that watching your weight, by eating a healthy diet, by being more active, is really, really important for your overall health and particularly for cancer recurrence as well. We know that people who are well nourished as they undergo cancer treatment have better outcomes. They are better likely to tolerate treatment. They are better likely to respond to and recover from that treatment more quickly. They might have immune function issues that are impacted by poor nutrition. And so absolutely, the second you're diagnosed, that really is something we encourage people to think about and seek a professional to get some insight. Talk to a dietitian. If you have access to a registered dietitian through your cancer center, through your hospital, great. If you don't have access to somebody, you can go to the American Academy of Nutrition and Dietetics website at eatright.org and find a nutrition professional. From a bottom line perspective, look for a registered dietitian. Registered dietitians have very clear standards of practice, standards of training, requirements for continuing education, and they're one of the best bets for you to go after to get good, solid nutrition information. And now, just recently, within the last few years, there is a new specialty certification for dietitians who specifically work in oncology with cancer patients. They are now titled Certified Specialists in Oncology, CSOs, somebody who really, really knows oncology, who's really going to be able to look at your specific situation, your specific cancer type, your treatment, your current status, and really make good, strong recommendations for you moving forward.